Welcome to our webinar. We're very happy to have you here today. My name is Rita Cronice, and I'm delighted to introduce what we have as a very exciting opportunity coming up through our PeerTAC Technical Assistance Center. My name is Rita Cronice, and my co-director, Yvette Kelly, will be kind of splitting this session today and sharing a little bit about this great opportunity that's coming up, which we're calling Bringing Peer Support to Scale in Mental Health Outpatient Treatment and Rehabilitative Services. The acronym, our learning collaborative. So we'll be talking a little bit about what we have planned, and we're hoping that you all will want to join us. So our agenda for this particular session is we'll give a quick welcome and introduction to ourselves, and we'll learn a little bit about you at the same time. I'll give a little bit of an overview of what PeerTAC is and what we've accomplished so far. And then Yvette will take over and talk a little bit about the Learning Collaborative, the eligibility for joining it, some of the required activities for participating in it, and then sort of the timeline and the application process. And at the end, we'll save time for questions and answers. But if you have questions along the way, please do feel free to put them in the chat, because our technical team of Angelique and Matthew will be gathering that information along the way. If they want to let us know that there's a question that's pertinent to what we're talking about, we'll certainly answer that at that time, or we can hold them till the end. So again, my name is Rita Cronice. I'm a coordinator for the Academy of Peer Services, which is out of Rutgers University. I'll mention that a little bit more in a minute. And I'm also co-director for this Peer Support Technical Assistance Center. Yvette, do you want to introduce yourself really quickly?
Yeah, sure. Hello, everyone. Happy to have you join us this afternoon. So Yvette Kelly, I am the Director of Children's Services and Healthcare Innovation here at Mixed Silver, but also the co-director for PeerTAC. I'm a licensed mental health counselor by training, and we're just excited to chat with you today about what we're going to be offering in our Learning Collaborative. And so thank you, Rita. I'll turn it back over to you.
Thanks. So we'd also like to learn a little bit about all of you that are on the call. We have a poll that Angelique is going to launch for us, and you can tell us what your role is. We call this the roll call. So you can tell us a little bit about your role, and it gives us more of an opportunity to understand who's in the room and how we can maybe tailor what we're going to be talking about to make sure we're meeting the needs of each of you that are here. So I'll give you just a minute to fill that out. I see, yep, we're getting close. Super. I can see that we've got quite a few program managers and clinic leaders, which is excellent. We're welcome. We're really glad to have you here. We've got some clinical supervisors. We've got some peer support professionals, a few folks from human resources, and a few folks from the C-suite. So it's really great to have all of you here. Do you want to go ahead and share the results now, Angelique?
Yep, it should be sharing.
Okay. Great. So hopefully all of you can see where we're at with who's in the room, and that's terrific. And I'm going to just go ahead and give a very brief introduction to PeerTAC. There's much more that we can say, but there's a lot of information available about who we are on our website and other places. So who we are is we're a technical assistance and training center, and we provide ongoing support to mental health organizations on the inclusion of peer support services across the lifespan. I think what's really unique about PeerTAC is we've combined the adult peer support services with the family peer advocates, with the youth peer advocates, and across the entire lifespan, we are able to provide peer support to people, at all stages and levels. We're really encouraging organizations to include peer support services from qualified New York certified peer specialists. That's kind of out of my realm. I'm in the adult side of the peer support services continuum, and the New York certified peer specialists are certified through the New York Certification Board. We also are really looking for organizations that are bringing in family peer advocates that are credentialed, and youth peer advocates that are credentialed, and they are credentialed through through Families Together in New York State and through the CTAC, the Community Technical Assistance Center, which developed a lot of the training and the certification, the credentialing process for family and youth peers. And Yvette can talk a lot more about that if you have questions about that as we go forward. Our vision, we seek to ensure that all people, regardless of age, race, socioeconomic status, stigma, or other factors that can limit the ability for people to recover, to have the option to receive peer support services, because we know that peer support services are one of the most beneficial opportunities that people can take advantage of to really move forward in their recovery. And we really are, our particular focus is to make sure that the ability for people to receive those services is there. And especially and now that the services can be offered through the mental health outpatient treatment and rehabilitative services clinics, that opportunity is there as well. So who is PeerTAC? We are co-led by Rutgers University's Academy of Peer Services and New York University's McSilver Institute, the Managed Care Technical Assistance Center and the Community Technical Assistance Center through McSilver. Now, I come from the Rutgers University Academy of Peer Services, doing a lot with the adult peer services. I was one of the authors of the certification training program for adults. And I've been involved with peer support for 20 years. And I'm passionate about it because I know how well it worked in my own life. And I've seen it work miracles in so many other lives. So we're hoping that we can encourage you all to take advantage of that opportunity. We also are working in partnership with Families Together, with the Wellness Collaborative Independent Practice Association, which is a group of 12 peer-run organizations that have come together in a practice association. We're also working very closely with the Alliance for Rights and Recovery, which is the new branding for what used to be NIAPRS, or the New York Association of Psychiatric Rehabilitation Services. NIAPRS has recently become the Alliance, and we're working very closely with them, as well as the New York Certification Board and a number of other organizations that you see listed here. We have a lot of groups that are working closely with us to make this a successful opportunity for, especially right now, the clinics to be able to include peer services. So what do? We provide a tiered menu of training and technical assistance. We're doing learning communities, and that's a part of what we're doing, is this learning collaborative that we're inviting you to come and join. We're doing online and in-person training for providers and the peer workforce. We're also providing resources and tools, and we've been developing a number of different tools. This learning collaborative is going to take advantage of one of the tools that we've just developed. You all will be the first, if you join us, you'll be the first to actually take advantage of learning from that tool, and we'll all sort of learn together how well that works, as well as responsive training and technical assistance. So the MHOTRS learning, the learning collaborative for the clinics is going to be, the focus of the learning collaborative is to assist organizations in developing actionable strategies for building and preparing your organizational culture and staff for the successful inclusion of peer support services. And we have a couple of focus areas that we'll be working with through that learning collaborative. Mostly we'll be having you take a look at what's happening in my organization that I might want to make a little bit of a change to make it more conducive to bringing peer support services in. And we'll be looking at how to support you in that effort. We'll be bringing together a number of experts. You saw that whole list of different organizations that we're working with. We have experts coming in from many of them, as well as ourselves, leaders and providers that will engage in this program from across the state. We'll be having peer-to-peer discussions focused on our four core areas, which is, what is the peer role? What do peer support service, what do peers do? What don't they do? What's fidelity to the peer role? We'll be examining a lot of that in depth. What does an organizational culture of recovery and resilience look like? How do we embrace that kind of a culture? Hiring and onboarding, so making sure that we're getting qualified staff in and that they're getting the training that they need to do the job that is being asked of them. And supervision, which is one of those key areas that we're all sort of trying to figure out with peer support specialists, given the different constraints that we have under Medicaid funding. So you all, if you join us, will be able to deepen your understanding of the role of peer supporters across the lifespan. You'll gather useful information, guidance, and support from other participating organizations. So the others that are taking this learning collaborative with you, it'll be kind of a learning with and from each other, which is a great way to, explore how to do things, and do things well. And then beginning to identify innovative strategies and solutions to resolve implementation challenges as part of your overall plan to support the inclusion of peer support services within your organization. And with that, I'm going to hand it back over to my co-director, Yvette.
Yeah, thank you. Thank you, Rita. Thank you for that introduction, and good afternoon, everyone. And once again, just thank you for joining our webinar today to learn more about the Learning Collaborative that we are going to be launching at the top of the year. And so we're very excited about this opportunity to really partner with providers to kind of walk through some of the key aspects for organizations to consider when preparing for the inclusion of peer support services. Preparation is a critical and continuous process, and we hope that by joining us, it will help your organization in the onboarding and delivery of peer support services. And so the next few slides are really just kind of going to go through the eligibility requirements for the PeerTAC Learning Collaborative. And again, just to say, as we walk through these requirements, if you have questions, please chat them in. We will allow for some time at the end of the presentation to answer those, but really just, I think our goal focus today is to just make potential participants aware of kind of what the expectations are related to participation in our learning collaborative, but also what agencies can look forward to getting out of the learning collaborative. So again, excited to see so many of you on our call today. So the first thing that we're going to just talk through is the requirements for participation in this learning community. Rita did a great job kind of talking about who we are, PeerTAC, what our charge is and what we're working on. And so our focus is really assisting mental health providers and more particular, the mental health outpatient treatment and rehabilitative services providers and the onboarding of peer support services across the lifespan. And so with that as a charge, that is one of our eligibility criteria, know that language as well, to participate in the learning collaborative. The other thing, and I'm just going to hold for a second to make sure folks can hear me because I'm getting a kind of an internet issue. Rita, can you still hear me? Just want to make sure.
Yeah, you cut out for just a second. So maybe if you would back up to the second bullet and say that again.
Great. Perfect. Because I actually didn't get to the second bullet yet. So that's great. And so in order to really truly benefit from this learning collaborative and build on the collective impact approach needed to implement sustainable change, we're asking that organizations be available to attend all sessions. And so the goal here is that this is going to be, and we'll talk a little bit more about, like an 8-session learning collaborative. It's going to run from January into June. And so we have some already identified dates and times. And so whenever possible, we want to make sure that folks who are able to join us are able to join us for all of the sessions. We do recognize that urgent matters do come up during the course of the workday, which individuals will need to attend to. But our hope is that participants will really carve out times in their schedules to be available. And so barring any emergencies, obviously, that they will join us for all of the sessions. The sessions will be structured to include a didactic portion from a subject matter expert. Here on PeerTAC, we have our internal resource team, but we also work with a number of consultants, as Rita kind of spoke about. And so we will be pulling from the experts have great experience in delivering and onboarding and implementing these services. And so they'll be joining us for some discussions, some presentations, and then we will be having some discussions with other peers who have been, doing these services for some time. And so we really be looking to leverage other people's expertise and knowledge and hear from folks. And so that is kind of what the expectation is in terms of eligibility, but what you guys will be getting out of the Learning Collaborative. Some of the other requirements is that we are asking programs to identify a core implementation team that includes up to 5 staff members with a variety of skills, perspectives, and circle of influences that can support this process. We'd like for teams to include team members that are fully committed to peer support service delivery, that understand their role in the preparation process for onboarding these services, and team members that are empowered and equipped to plan for and implement changes. And so it will be important for a staff member who's in a position of leadership or has access to leadership to join the team for that reason. And so that's going to be important. And when we talk about recommendations for who to include on these teams, we'll just talk a little bit more about the team members we feel would be critical to participating in this learning collaborative. So obviously, there's a number of you on the call today, so that was really exciting. But we would think we should include a staff member who's a clinic director or a program manager. And again, we talked about the importance of having someone who's able to really attend and to resolve organizational and programmatic barriers. We know that these types of issues will inevitably come up during the process, and we need a team member who's going to be well suited to address these concerns on a leadership level. And so that's kind of why we are recommending this position. We're also recommending a staff member who is a clinic supervisor. And so this person is going to be key in understanding kind of workflow, the needs of staff, as well as the needs of those being served. And so we're going to need their expertise to kind of build out, some of the actionable strategies that we're working on. So we're going to request that you have a team member who is a clinic supervisor, and again, can be supervising clinicians, peers, or both. And so that's going to be important. We also want members who are clinicians, right? I didn't see, based on the poll today, I don't believe that we had a number of clinicians on the call, and that's understandable because, right, these are the folks who are on the ground floor who are doing the billing and doing the work. But if possible, we would love for them to be included on the team. We actually think it's a critical piece. So if someone could be identified from your team who's a clinician who can join the Learning Collaborative, that will be great. Clinicians as well as peer providers, and I believe we do have a number of them on the call as well. So happy to see that. But we need their perspective. We need their perspectives on service delivery, staff concerns, as well as how those being served are experiencing the service. And so we're going to need to bring all of that forward. And so they're a critical part of the team, and we want to encourage their participation. And then there are a number of other team members with whom the program works that really supports the daily operations, right? So you have human service professionals who play a critical role in the onboarding and training of staff, right? They have a critical role in helping programs think through and articulate competencies and responsibilities for peer support providers, as well as other positions. So we will need that expertise. It will be important as we're thinking about the competencies required and how we are drafting and looking at job descriptions and whether they're meeting the mark for what we want to accomplish. That's that's going to be essential. And so that's why it's important to have someone who can speak to that. And then your quality improvement staff, which really ensures that programs within the organization remain compliant with regulatory requirements. And so it's critical to have their perspective and expertise as well. And so these are the members that we really believe would be beneficial to joining the Learning Collaborative. Now, we also recognize that perhaps in some of these programs, there may be a person who is one and of the same, like one person doing the role of two different areas, and that's fine. And that's why we set up to 5 staff members, but we really want teams to think about who should be part of this team and part of this initiative to be able to drive this forward, and that's going to be a critical piece. So those are some things to think about as you guys go back and meet and decide whether or not you like to participate, but also to talk with the folks who you'd like to bring in on this Learning Collaborative to see what their availability is for participating as well.
So Yvette, I think you're going to get to this later, but there was a question that popped up that I think is important to answer now, and that is, should all 5 team members be attending all 8 sessions?
Yeah, that's a great question. Our recommendation would be yes, whenever possible, if all of the team members can attend every session, that would be great. I will go back to what I said, right? So recognizing that this is a learning collaborative that spans several months, recognizing that you guys are working in some very tough environments and there's workforce concerns. I think we recognize that there will be on occasion where not every team member is able to attend for a particular session, but I'll just go back to say whenever possible, right? Whenever possible, if all team members can participate, that would be helpful.
I think a part of it is that there's a lot of interaction that's going to happen during those team meetings. So even if they went back to review something that's a recording, they're still going to lose, and we're going to lose their input going forward.
Yes, absolutely. And so we want to make sure, like, I think what we're trying to leverage the expertise out of this learning collaborative, right? And so I think part of that is having everyone at the table and talking through these concerns. And we're going to try to make, we're going to try to make it as interactive as possible. So again, some portion of the sessions will be like some presentation, but a lot of it will be connecting with your peers who are providing this services, talking through those implementation about, challenges and barriers and kind of problem solving. So again, it will be important to have everyone's perspective at the table. All right, so there will be a number of activities that we will be requiring of participants. And again, we're sharing all of this information so that you guys can make informed decisions about your ability to participate, but also we want you to know that there's a richness in this learning collaborative, and there's a lot of things that we think you'll be walking away with that will really put you in a better position and have you gain better understanding of, what it takes to really I think build a very strong team, right, for the inclusion of peer support services. And a byproduct of that will be including really satisfaction among all of the staff, right? So bringing that into consideration as well. And so we want to just talk through what those activities will be so that you're aware, because we really want organizations to commit to this. That's what we're looking for. And again, the goal of the Learning Collaborative is to develop actionable strategies for building and preparing your organizational culture and staff for the successful inclusion of peer support services. And so to that end, we have a number of activities that we think are important to that. And so one of the things that we want to talk about is really just, I think, having the ability for your core implementation team to meet regularly. And we're asking this in addition to your time participating in a learning collaborative session. So we know that to make sustained progress, it will take focused time and energy. So ideally, teams will be able to meet at least twice monthly outside of the learning collaborative time. And so that's part of some of the activities that we would think would be necessary. We talked about the commitment, which again, to just attending all the scheduled sessions. And again, it's to truly benefit from the collective impact approach and hearing from others and hearing from peers. So that will be important. We are also going to be asking organizations to complete an organizational self-assessment, and I'll give you some details about that shortly. But basically, this assessment will help to initiate a dialogue about the need for change and the identification of like critical next steps and areas of focus. And so again, I'll a couple slides later, we'll detail what exactly that organizational self-assessment looks like. But that will be an ask. We will be asking our teams to participate in an hour-long coaching call with one of our resource team members. And the purpose of this call will really be to review and discuss the team's goals, the needs, to check in on progress, to talk about any challenges that have arisen or that teams foresee, and then any successes that they've experienced in the process. And so we will pair you with one of our subject matter experts, depending on kind of your area of focus, and work to really support you around that. There will be, we'll ask you to develop basically an action plan, so an implementation plan based on feedback that you will receive from the organizational self-assessment for the onboarding and delivery of peer support services. This will not be anything, I think, major. It's going to be dependent upon what your team feels you'd like to begin to work on. And it could be as small and as big as you see fit, right? So we want you to really be thinking about that. And again, that's why one of the things that we're going to have you do is complete that assessment so we can take a look at areas in which folks are, doing well, and areas in which folks, there's opportunities for growth and for development. And then always at the end, we're going to ask groups to really give us some feedback on what you learned and took away from the experience, just to help us as we kind of may do some other learning collaboratives in the future. We want to make sure that that all of our learning objectives are met, and we want to hear about your experiences in that process. And so these are the required activities that we will be asking participants to participate in and join us. And then there's also just going to be, we're going to ask you to do like a very brief presentation at the end to summarize your experiences and share with the group in terms of what your plan was. And again, to talk about your progress and next steps, very brief presentation. So maybe five or 10 minutes, but nothing much more, depending on how many folks we have to accommodate that. So we would be asking for that, and that would be an expectation as well. And so that is going to be the required activities. And I'll stop there just for a minute to see if there's any questions. Okay, I'll move right along. And so again, one of the things that we're going to be asking organizations to complete is our PeerTAC organizational self-assessment. And so this is a self-assessment that the PeerTAC team, the PeerTAC team, along with our advisory council and some of the experts in the field, helped us pull together. And so we pulled this together as a way of really, I think in part making it an educational tool for folks to reflect on kind of what are some best practices around peer support service delivery, but it also allows organizations to be reflective on their own processes and kind of identify some targets for implementation. And so this is the tool that we're going to be using. This learning collaborative will be the first group that is going to be piloting this organizational self-assessment. And so we're going to see how that works. And so we'll be getting data on the tool as well. But we did spend a number of months developing this tool. And so we're looking forward to having you guys use this as a way to identify areas that you are doing well in, areas that you'd like to improve upon, and then really utilizing it as a starting place to figure out where you'd like to go next. And just to say again, the OSA it's been adapted from nationally recognized resources on peer workforce inclusion. We've used a variety of sources and came up with this tool. And so a little bit more about the tool. Good news is the tool is not lengthy. And so the tool consists of 25 statements that really, again, allow you to rate your organization's current knowledge and application of peer support values and practices. And this, again, it includes examining your organization's culture, hiring, and supervision practices. Again, those 4 core areas that we are going to be focused on in this learning collaborative. And so once you come in and join us, we'll ask you to complete this, and then we'll talk about kind of what data you get back to really help you kind of build out what your implementation plan is going to be. We also want to say that we recognize that every organization is, will be at a different stage with unique challenges, right? So everyone that who's going to be, all organizations, they're not in the same stage of implementation, right? There will be organizations who perhaps have implemented, adult peer services. I'm just using that as an example. And now they're looking to implement youth peer services, or perhaps there'll be organizations who've never implemented peer support services, and they're looking to do so. And so, I think each of those groups will have unique challenges. And so we're going to be reflecting upon that in our learning collaborative and talking some of that through. And we're, and really bringing in those best practices with the goal of really making sure that what you're delivering around peer support services is sustainable over time, sustainable and successful. And then after you complete the assessment, again, there'll be a number of metrics on the assessment. And I also want to mention that, let me go back a slide, because I think this is important. To take a look at our OSA. I also wanted to say that the categories and how we have you rating the specific areas really kind of mirrors how OMH is utilizing the tool for auditing purposes to rate clinics. And so we have it parcel out in terms of exemplary, adequate, and needs improvement. And so if you guys have been through that process, you are familiar with that rating scale. We've mirrored this to be consistent with that. And so you will see that here. And again, the goal of this is really just to identify those things that you're doing well, but help you identify places where organizations and programs can make improvements.
Yeah, I just wanted to jump in and mention that, OMH isn't going to be using this tool at all to rate you. We mirrored the standards of care that OMH uses, as you're determining how well your standards of care are working. We just took those same categories and applied them to this organizational self-assessment, but it's not something OMH is going to be looking at all. So we just wanted to add that.
Yeah. Yes. Thank you for that clarity, Rita. And so after you complete the organizational self-assessment, we're going to take the data back, and organizations will receive their individual organizational report that, again, that they can use to really look at and how they rated the scales, what that means. There likely will be some benchmarking across, for your cohort that you're involved with. But really, again, you're going to use this as the basis to begin to develop your implementation plan. And so, this is it's really for your purposes to help you. And so, again, you'll be getting data related to your agency, and that will help you kind of drive your plan forward. I mentioned this a couple times, but just to say this again, we have a number of people who are on board to assist in this learning collaborative, a number of subject matter experts. We are really going to tailor the needs for providers based on what you bring to this learning collaborative to ensure that we are addressing the concerns, the questions, the topics that come up during the session. And so again, you're going to be engaging in a consultation call with subject matter experts, tailored to your specific agency and need. And I think it's just a great opportunity, again, to connect with, fellow peers across the state who have been doing this. We're going to leverage some of that expertise and some of that knowledge. And so I think overall, if providers are looking to really move forward in their peer support service delivery, that this is going to be a great opportunity for providers. And again, will be a combination of our PeerTAC resource team and our outside consultants. All right. And so next up, let me just walk through the application process and the timeline so that you guys are familiar with what's expected. And so the first thing that we're going to recommend that you do is to meet internally to determine if you're able to meet the participation requirements. Again, we reviewed those. These slides will be posted and available. And so if you have team members who are not able to join us today, you can definitely refer them to this presentation, and they can get some additional information in terms of what is going to be required for this learning collaborative. But again, I think it's important to meet and all get on the same page regarding participation. We do have an application process, and that application is going to be completed via Qualtrics Online. And it's going to be due by the end of the month, so December 29th. It's, I believe, a short, maybe like 10 question application, but it does require you to have some information around team members and things like that, and the demographics of your program. And so we do ask that you complete the application. The application link will be mailed out following this webinar. I would say look for it early next week. We'll send it to all the registrants who signed up for today's webinar, so you can see it there. And so just to say again, I just want to reiterate, this learning collaborative is specifically for mental health outpatient rehabilitative support providers. So you do have to be identified and designated by OMH as one of those providers to participate. And then once we receive applications, we will look through the applications. Obviously, we may not be able to take everyone who applies depending on demand. But we are, the earlier you can get the application in, the better. But then we're going to notify programs by January 10th if they are accepted. So you'll know then. And then after that, we will provide you with some the dates and times that the learning collaborative is happening, and we do have that here. But in the interim, if you have any questions related to the completion of the application, you can please email us at peertac.info, peertac.org, and we'll be able to assist you from that perspective. And so here are the session dates and times. These are when we are meeting. Generally, sessions will be about 90 minutes, but the first one happening January 24th will be a couple hours. That's our kickoff session. And again, these will be, when you get the slides and recording, these will be available. So you will have them and you can share them, and you can and add them to your calendar. Once we notify you and you're accepted into the Learning Collaborative, then you will have the option. We'll send the registration link for these dates and times, but we wanted you to have them ahead of time just for planning purposes. Again, recognizing that there's a ton of, a lot of people who are busy. We just wanted to make sure that you had this information so you're able to make an informed decision about participation. And so those are the eligibility requirements for our Learning Collaborative. Again, so just in summary, we are today's the informational session. Slides will be made available. There is an application process. Applications will be due at the end of this month. And then we will look through the applications and notify participants January 10th. At that time, you'll get an email with some additional information around acceptance and being able to register for the sessions that are upcoming. We are looking for providers who are looking to implement peer support services across the lifespan, whichever one that may be, or all of them within the next 6 months, I would say. I think if you are not looking seriously at doing it within the next 6 months, that this Learning Collaborative will not be as helpful to you. And so we're hoping that providers who are either in the process or thinking about it in the near future will join us. And so that I want to just stop for a minute and turn to my colleagues to see if there are any questions, and turn to the audience, all of you, to see if you guys have any questions relative to the Learning Collaborative that we can answer for you today.
I have one question right off the bat. Do they have to be people who are just thinking about or planning, or can they also be people, groups that have already got peer services but want to improve them?
Yes, I think it could be both, right? I think it could be both. So for instance, if you're an organization and you already have a peer on staff and you have adult peer services or family peer services, but you are looking to just understand more about how you can improve that service, yes, this Learning Collaborative is for you.
As well as adding an additional, like if I have adult peer services and I want to add family, or I want to add youth, as a new service, this would also be helpful.
Right. Yes, absolutely. Absolutely. I'd say if you are again, implementing peer support services or thinking about doing that in the near future, this Learning Collaborative is for you.
There was a question early on. Are clinics run by state-operated psych centers eligible to participate? I know, Rita, you answered in the chat, but I just wanted to bring that to everyone's attention.
Yeah, Rita, do you want to? I don't know what you answered in the chat. Can't see.
Yeah, if you're in Article 31, yeah, you're eligible.
Mm-hmm. Absolutely. And then there's a question I see here around is a presentation needed to present every month? And the answer to that is no. The presentation is just a summary presentation. It's one presentation at the end of the Learning Collaborative. Any other questions?
It might be good to also mention that this isn't an every other week or an every month. It's kind of every 3 weeks, which is an interesting cadence, but we hope it will work for people.
Yeah, it is. Yes. And just to talk a little bit about the timing, I think we are very aware of the constraints on people's time, right? And so we tried to create a schedule that gave a little bit more, wasn't so demanding, and gave a little bit more space. And so we're hoping that will allow folks to really participate, which is what we're looking for. And so that's kind of why the schedule is broken down as is. So I do see another question around, will you cover how to bill for peer services? We indeed will. we will have we will have some time to discuss, because in part that question has to do with implementation and sustainability. And so we will talk about that as well.
And I believe we'll be talking about documentation as well, right?
Yes, yes. So we'll be talking about all the things that is required to implement peer services within clinics successfully. And so all of those topics are on our radar. And I think also the other piece of this, we'll be giving information. You guys will be sharing information. It will be very helpful for us to hear from you guys as well, in terms of the challenges and struggles, and any concerns with translating the regulations into practice, because we have worked to really talk with, I think, other providers, but also understand from the ground level what it takes to do these successfully, and maybe feed that back to OMH as well. And so again, team, if you see any questions I don't see, please feel free to jump in. And
there's one, if I'm the only provider that can attend from my clinic, is that okay, or do you need a team?
yeah, we are requesting a team. So in the reason, again, I'll go back to why we're requesting a team, because part of this learning collaborative is to help organizations develop actionable strategies. And it's hard to do that if you're just the solo person who is attending the learning collaborative.
And Kevin added that June 19th is Juneteenth. Any way to change that date?
Yes, we can look at that. Thank you. Thank you for that, Kevin. We definitely can look at that. Okay. Any other questions? Again, please feel free to chat in.
Well, those are all that have been captured so far throughout the duration of this webinar. I just wanted to point out that if anyone has a last minute question, we can certainly answer it in the chat.
Thank you, Matthew. And maybe while we're waiting for any last minute questions, I know we did have a couple. I just wanted to kind of show, this is, our contact information. If you have seen some of our webinars but we always just like to remind folks that we have a website, PeerTAC.org. Please feel free to visit our website and see the resources that we have available. If you have questions for us, you can reach us by email at info@PeerTAC.org. And we do want to encourage you to join our listserv as well. We are going to be sending out a number of announcements related to offerings, resources, events of interest. And so want to encourage you to make sure you get that on your radar as well, so that you can stay abreast of what's upcoming. And so just wanted to share that as we close out for today. And again, check back in a couple of days. We'll have this recording available. So again, if your teammates were not able to attend, you will be able to point them in our direction, and they can take a look at this and see if that's something that they're able to do and participate in.
And I just wanted to reach back out to Joyce, as far as participating in the learning collaborative, that takes a team. We do have a number of other events that are coming up that individuals can certainly participate in, and we're looking at doing a summit later on in the year. So there's more things coming up, that just stay tuned, and we'll hopefully have things that you can participate in that will be of benefit for you too.
Absolutely. And just to say that we are really looking forward to this learning collaborative and having as many people participate as possible. And so, we just kind of want to encourage you to please, take it back, complete the application. We think that this is going to be a fantastic learning collaborative where providers are going to learn a lot. And so the time is right for it. And so again, just want to encourage folks. But thank all of you for just joining us and learning more about this. Again, we'll be sending additional reminders. Thank you, Kevin. Again, we'll take a look at that last final date before we release the application, to your point that it's a holiday. And we're also, I think, pretty flexible when it comes to that. And so again, thank you all.
Yes, thank you.
All right. Everyone enjoy their weekend.
Yep, I just wanted to say a big thank you to Angelique and Matthew for all of their background, help always being kind of there and providing us assistance.
Yes.
And Yvette, thank you for being a great co-director. And I want to also thank OMH. They've been a tremendous, sponsor of our PeerTAC initiative. And so we get guidance from them, but we don't necessarily report things back out to them. So we just want to make that clear that, they are supporting us, but we're really looking forward to working with each and every one of you if you can join us.
Yes, thank you. Thank you for that, Rita. And yes, thank you to our team. And again, thank you to everyone for joining us. It's always a pleasure. Looking forward to seeing your applications. And I hope you have a great afternoon. Thank you.